Good morning. I'm Dr. Kevin Cope. I'm the Lexington Medical Director, and it's good to talk to you again. I just wanted to talk to you this morning about the importance of getting a flu vaccine, especially this year, and I'm going to explain why. Every year there are 3 strains of the flu that the experts pick to be put in the flu vaccine because the virus changes from year to year. So they predict the 3 most common strains and they put them in the flu vaccine. So it's important that even if you got a flu vaccine last year, that's really not going to protect you well this year. So it's important every year to get a flu vaccine so that you're protected against the most common strains for this year. And I'm going to make a little analogy this morning, similar to why we're wearing these masks to protect other people from COVID. I'm going to suggest that you should get a flu vaccine not only to protect yourself, but to protect others from the flu. So you may say, well, I'm young, I'm healthy, I get over the flu very quickly, it doesn't bother me, and that may be all well and good, and that may be true. But you have to think about the people you live with, your parents, your grandparents, your children. Some children, young children, don't do well with the flu. Parents and grandparents with health issues don't do well with the flu. And think also about the people we support in direct care. Many of them have underlying health issues. They do not do well when they get the flu. In fact, the flu, if you look at the statistics, caused over 500,000 hospitalizations last year and about 24,000 deaths. So the flu is not something very simple, and unfortunately many people die from the flu each year. The flu is highly contagious, and that is why it's good for you to get that vaccination, because you may, like COVID, you may be able to spread the flu without even knowing you're sick. They've shown that you can be contagious a day prior to developing symptoms of the flu. So one day prior, you're actually spreading the flu around before you even feel symptoms. And you can spread the flu for up to 2 weeks after you get sick. So you may start to feel better, you may go back to work, you may be around your family thinking you're better, you're over it, and you're still spreading the flu. So it's very important that you get a vaccination this year to protect not only yourself, but your family and the people we support. I want to also mention, especially this year because of COVID, COVID and flu symptoms are very similar. So cough, fever, congestion, body aches, runny nose, sore throat, they can all be similar between the COVID-19 infection and the flu infection. So it's even more important in my mind this year that you get a flu vaccine, because you want to protect yourself from the flu so that we do know that if you do get sick, we do know that there's a chance you could have COVID, and you most likely will require a COVID test. But you'll be much more likely that you don't get sick with these flu symptoms if you've had a flu vaccine. So I just want to make that point again. And the good news is for all of our Lexington staff that you are entitled to get a free flu vaccine. I encourage you to take advantage of that benefit. You will be hearing more shortly about how you can get that free flu vaccine. Thank you very much for your attention this morning.